Tarun and myself, you were welcome to the last session on central nervous system and Zika virus. And to kick off, I will invite Susanna Land. She is an internal medicine trainee and clinical research fellow with the University of Liverpool Brain Infections Group. Susie will speak about her experience in Brazil researching neurological disease and Zika. Welcome, Susie.
Thanks, Lida. So yes, thanks for the introduction. Today I'm going to talk about the spectrum of neurological disease in Zika infection, and different from Sonia and Selina's talks, I'll focus more on central nervous system disease. So as Lida said, I'm from the University of Liverpool, which is in the UK. I'm part of the Brain Infections Group, which is led by Tom Solomon and works to reduce the global burden of neurological disease caused by infections in different ways, epidemiological and clinical studies, and also looking at things like disease mechanisms, diagnostics and treatments. And when we talk about nervous system disease, we talk about central nervous system disease. So that's things like inflammation of the lining of the brain, like meningitis, or of the brain itself, in encephalitis, and then you can have inflammation of the spinal cord, secondary to viral infection, which we term myelitis. Looking at this figure on the right, you can see lots of blue nerves spreading out, and that's the peripheral nervous system. So as Hugh and Sonia have discussed, Guillain-Barré syndrome is a disease of the peripheral nerves. And why are we interested in nervous system disease? Well, there's a high morbidity and mortality. So for example, in Japanese encephalitis, which our group specializes in, there's a mortality of between 10 and 30%. It's an area which isn't which is under-researched globally with few effective treatments. So there are lots of opportunities for improving diagnosis and management in these patients. And there are lots of international collaborations that the group has. And since 2016, that list has also included Fiocruz in Recife and Rio, and which was spurred on by the emergence of Zika virus in the Americas. So we've had some introductions to Zika, but just to say that it's from the same family of viruses as viruses like Japanese encephalitis and dengue, which are known to be linked to neurological disease already. So whilst when Zika emerged, for many years, it was not recognized that it was linked to neurological disease. Perhaps it's not a complete surprise that there is evidence that it invades the central nervous system and causes neurological disease. It spreads from human to human by mosquitoes principally, but also, as Selina mentioned, from human to human directly, more rarely. And in most patients causes mild disease. However, since 2013, we have recognized that there is this link with neurological disease. And that was Guillain-Barré syndrome recognized first, which Sonia spoke about, and microcephaly and congenital Zika syndrome, which Democrito and Selina have spoken about at length in their great talk. And as Lucia Brito described at the beginning, she also recognized early on in the Zika pandemic, beginning in the Americas, that it wasn't just Guillain-Barré syndrome, but also other kinds of nervous system disease, such as meningitis, encephalitis, and also we tend to think of meningitis and encephalitis as sort of conditions that are linked to direct viral infection or occur around the time of infection because of early inflammatory responses. But also Lucia had seen in her patients with sort of later presentations of more immune-mediated nervous system disease that seemed a bit like MS, something called ADEM. So it's not just meningitis and encephalitis, but also other kinds of inflammatory disorders and spinal cord infections. And that these patients had a high level of sort of impact on their function from these diseases. So why was it that this association only really emerged in 2013? Well, there are lots of reasons, and it's difficult to pinpoint one, but there have been reports of sort of changes in the virus. And I think with COVID, it's interesting how probably everyone's much more literate about things like viral mutations, diagnosis of viral infection, and surveillance and epidemiological studies. So maybe whilst Zika was circulating in Africa and Asia, there were cases of neurological disease, but which weren't picked up on, particularly because we recognise that these are quite rare complications of Zika virus infection, but very serious rare complications. Perhaps we needed to have an outbreak that was as large as the one in the Americas, or in French Polynesia and then the Americas, to recognise these complications of Zika virus infection. And maybe it's also something to do with the population, for example, exposure to other kinds of viruses before, such as dengue, or genetic differences. In terms of researching Zika, I think it's probably more challenging than it first seemed, or at least when I went into this field, than I first anticipated, because of course patients might develop neurological disease following Zika virus infection, but Zika, like COVID, does not always cause symptoms of viral infection in patients. So our patients that develop neurological disease following on from Zika virus infection are always symptomatic. And then when they develop neurological disease, they don't just look like one kind of syndrome. Often they develop many different syndromes, many different symptoms. So that's quite challenging to pick up on as a clinician. And then once you recognise that they have this neurological disease with or without preceding infection, the challenge of diagnosing that infection in a laboratory. So I think these challenges highlight just how impressive it is that Lucia Brito picked up on these things with her epidemiological approach to clinical practice. So what have we done specifically? Well, as our broader clinical neuro-Zika working group, which actually included most people who've spoken today, we had a number of aims, and I won't talk about all of them today, but I'll just focus on some of the clinical studies which we've done. So early on, Tom Solomon and Cristiani Suarez, who I think has joined today, as well as Ravi Mehta, and Raquel and other people from Zika Plan, wrote up some early case reports, in addition to the case reports that Lucia Brito was producing in the north of the country. And Ravi, Raquel and Cristiani Suarez also then went on to publish this nice study, which was important in giving us an idea of the spectrum of neurological disease in Zika virus infection, which previously had been thought to be more limited to Guillain-Barré syndrome. And not just Zika virus infection, but also at that time, chikungunya emerged as a kind of cause of viral illness epidemics in Brazil. And in this study, it was clearly defined that chikungunya can also cause neurological disease of the central nervous system and possibly Guillain-Barré syndrome. In addition to those findings, it was also highlighted that patients presenting with neurological disease weren't just presenting with neurological disease and Zika virus infection, but also sometimes had more than one infection with Zika and dengue, or Zika and chikungunya. And as part of this work, the team established some clear neurological case definitions. So Ravi Mehta led on this. And I think it's important for research globally to have sort of standardized, accepted definitions of how we understand what these neurological patients look like for research and for clinical practice. Moving on from that Rio study, we had a larger study which was led by Lucia Brito in Recife, and rather than 22 patients, we had over 200 patients with neurological disease. And in those, we found that 148 had evidence of recent arboviral infection, and that was in an adult population in Hospital da Restauração in Recife. Of those 148 patients with arbovirus infection, 50, so just under a third, had infection with more than one virus. And as you can see here, they had infection of the kind of within the CSF, indicating infection of the central nervous system, which is in those darker central circles, as well as infection in the blood peripherally. These patients were not limited to just Guillain-Barré syndrome patients, but actually around a third had central nervous system disease, about a third had Guillain-Barré syndrome, and then there were also about 13 patients who had strokes. And we saw patients with Zika and neurological disease in 2015, as we might have expected, because that's when the Zika epidemic was happening. And then following on from that in 2016, chikungunya sort of joined and took over, and there were many patients presenting with just chikungunya and neurological disease, but also with Zika and chikungunya co-infection. So the key findings from that study, because we were able, with the numbers of patients we had, to compare what patients with chikungunya, what diseases they were developing compared to patients who had Zika virus infection. And we found that Zika virus patients do develop central nervous system disease, but they, compared to chikungunya, more frequently had Guillain-Barré syndrome. Whereas chikungunya patients more frequently developed central nervous system diseases such as encephalitis and myelitis. Importantly, in this study, we also found that infection with more than one virus was common and may also increase the risk of cerebrovascular disease and stroke. And I think the link between infection and stroke is something that has become increasingly pertinent and important in neurological infectious diseases research during the COVID pandemic, because we see that very frequently. Moving on from these studies, we then conducted a case control study across Brazil through 7 sites in Rio and 1 in Recife in children and adults. And we were looking to see if Zika was a true risk factor for neurological disease, and what, if so, what is the increased risk of neurological disease following infection with Zika, but also with chikungunya and with dengue. So we compared infection in cases and controls and tested those samples and recruited over 400 cases and 800 controls. And we're just completing the analysis of that work. But we think this will be really key research for public health policy planning, thinking about things like vaccination and other campaigns. We've used our Zika Plan network definitely, and research, learning from that research, and applied it to COVID. And I think it's had a huge impact, Zika Plan, in terms of kind of building up networks. Lena mentioned networks between healthcare researchers and policymakers, and I think that's very clear that Zika Plan had a big impact in that area. Obviously, we've developed our improved understanding of neurological disease in Zika and chikungunya. And the Zika Plan projects have led on to lots of additional funding and ongoing collaborative projects between the UK and Brazil and elsewhere. So thank you to everyone for all of your work. Obviously, I'm presenting the work on behalf of many different people, and I'm happy to take any questions.
Thank you, Susie. Maybe I kick off while the others come with more questions. It's for the people in endemic areas of Zika, how will you say them to be aware of potential central nervous system infection due to Zika or vector-borne diseases? For a patient, when are he aware, how he can be aware of this involvement and seek care, and what will be the reaction of the emergency doctor? Is that important for him to distinguish whether it was Zika or other infectious disease of the central nervous system?
Yeah, well, definitely. You mean, is it important for the patient to kind of seek medical assistance for diagnostic purposes, just so we have that epidemiological data?
Yeah, he suspects he has Zika or chikungunya. And then he may expect at some point, how many days after, what will be the landmark symptoms for him to suspect the central nervous system involvement after Zika or chikungunya or dengue?
Right. Well, in encephalitis, people typically develop things like seizures or reduced conscious level, and meningitis is more to do with kind of headaches, photophobia, neck stiffness, and I think what was clear from this cohort is those kinds of patients tend to develop neurological symptoms quite early on following on from infection. So I guess people should expect that that those symptoms might happen earlier on, although we did also see patients who develop, as I described, more immune-mediated sort of brain complications, and they can happen a bit later. Obviously, with Guillain-Barré syndrome, that's more things like weakness and loss of sensation, or problems with speaking or breathing. But I think you've raised an important point, like how do you sort of educate the population about those things and have a broader public health impact rather than just characterizing these studies? How do you educate and engage people to seek help when they have those symptoms? And I think the other question you sort of mentioned about how important is it that we know that it's Zika versus any other viral cause of these neurological problems? Well, I think in terms of sort of diagnosis and treatment, although there aren't many treatments for Zika, well, there aren't treatments for Zika, chikungunya, and dengue specifically. These patients can deteriorate quite quickly and need more intensive care support or, sort of intubation and ventilation. And obviously, if it's not Zika, chikungunya, and dengue, and it's something like herpes simplex virus encephalitis, then we know that acyclovir can have a huge impact on morbidity and mortality, and people need to be treated with that early on. So it is, I think, very important that we have diagnostic data on these cases.
Thank you, Susie. I think, Selena, you wanted to ask a question? That you have your video on. Okay, sorry. Do we have any more questions? Carlos or Aaron?
This is Joe. I don't know if he's got a comment as well, if he's just ready for the next session.
Tom, I cannot hear you properly.
Maybe I'll just ask Susie one quick question. You mentioned the increased risk of stroke in patients who have dual infection. And of course, now in this COVID pandemic, we've seen quite a lot of stroke. Do you think there are more causes of infection precipitating stroke that perhaps have gone under the radar up till now?
Yeah, well, we know that HIV, for example, is something that's definitely linked to stroke. And there are observational studies on dengue and stroke, which I've seen. So yeah, probably I think it's not quite clear. I think probably the mechanism for different viruses is different. So for HIV, we know it's more of a vasculopathy, whereas for COVID, increasingly it seems that it's not really related to kind of viral invasion, but maybe a more coagulopathic immune-mediated type picture. But I think increasingly we're seeing that viruses are really important in thinking about causes of stroke.
Tom, if there is a minute for a question and comment, I think that Susie outlined a very important aspect of the epidemiology of viral diseases in Latin America. One of the emphases during the current pandemic of COVID-19 is clinicians need to be aware that it's not only COVID-19 producing neurological problems after February of 2020. There is still dengue, there is still Zika, there is still chikungunya, there is still Campylobacter, and clinicians need to be aware about establishing a very good laboratory diagnosis in cases of neuroimmunological or neuroinfectious disorders.
Yeah, I think you're right that we need to
just to add to that
better the burden of the disease. Go, Taram.
Yeah, no, just to add, I think this has also not only from a clinical angle, but from a policy and surveillance angle, that it is important. I think the data that Susie showed in terms of different viruses that can be associated with neurological problems and also co-infections. I think that shows that how we need to have better surveillance systems established and the diagnostic capacity strengthened across various parts of the world. So, this is about Latin America, but then there are different viruses that are circulating in Africa, Asia. So we need to build up those systems, in addition to the clinical patient care that we are talking about today. So I just wanted to emphasize this additional point, rather than, this is more a comment, Susie, rather than a question here.
Yeah, okay. Very important. Thanks.
So we hand it now to Tarum to introduce our next speaker. Thank you very much, Susie and all.
Thanks.
Thank you. And so we move on to our next speaker, Carlos Pardo, who doesn't need much of an introduction. He's a professor of neurology and neuropathology at Johns Hopkins in United States. And he's the coordinator of the neuroviruses emerging in the America study based in Colombia. And he would be talking to us today about the impact of Zika plan from research to patient care. Carlos, over to you.
Great, thank you, Taran, for the introduction, and thank you to Zika Plan and all the organizers of Zika Plan for the opportunity to get involved in this research project. It has been a great pleasure to be part of this consortium. The major issues that we deal in Colombia back in 2015, 2016 were basically related with an emerging outbreak that was very important in the context of the public health situation in Colombia. So what I'd like to bring today is basically what was the impact of the Zika outbreak in Latin America on clinical research and patient care. We are researchers, but our research actually needs to translate in a very important effect on public health measures, and particularly patient care. And while we are learning about the immunology of viral diseases, the virology and diagnostic approaches, actually the end point is patient care, and make sure that we have a very good investment in improving the quality of care of our patients. So I like to bring the example of Colombia and the network that was established in Colombia after the Zika outbreak. In Colombia, as Brazil and many Latin American countries, there has been a cycle of outbreaks of arboviral infections, particularly dengue. And we traditionally have recognized that in the context of the public health situation in many areas in the country. One thing that was very important is to recognize that actually preceding the Zika outbreak in 2015, there was a quite striking amount of cases of chikungunya that actually was overwhelming for the public health scenario in Colombia. But obviously Zika came, and Zika allowed us to have a much better view of the neurological problems. And I think that in the past we had ignored the neurological problems of dengue, chikungunya, but when Zika emerged, obviously the amount of Guillain-Barré cases indicated in this graphic in red versus the cases of Zika was really overwhelming. But one thing that probably we learned that after the period of Zika outbreak, there were still neurological problems and neuroinflammatory problems show up despite Zika was gone. And this is important because it's extremely necessary for many countries in tropical areas to be aware about the emergence and persistence of some of the viral diseases and infectious disorders. So in Colombia, in January of 2016, we established very quickly a network of academic centers, and basically with the leadership of a virology group led by Beatriz Parra and epidemiology by Lida Osorio, we were able to form an extensive network of neurologists, physicians, healthcare providers that basically tackle rapidly the concerns about the emerging problems with Zika, particularly neurological problems. And you are very familiar, that led to the description of the characteristic of Guillain-Barré in Colombia. But what I like to discuss with you today is mostly about the aftermath of the experience. And I like to emphasize that in the past a few years after the outbreak of Zika was basically over, we continue the effort in identification of neurological problems in the context of infectious disorders. So we continue an effort in identification of risk factors, but particularly one of the most important aspects is the improvement of the diagnostic capability, the diagnostic resources in Colombia and around the country, and particularly the establishment of this clinical network that facilitates a better understanding of the relationship of infectious disorders, particularly viral disorders and acute inflammatory disorders. So this is important because we need to improve, and one of the efforts that we have established for the network is to improve the therapeutic intervention, the capability to diagnose these patients correctly, and particularly to educate and disseminate information to healthcare providers that allow us to continue our effort to serve patients. So NEAS as a group is focused not only in the clinical analysis of cases that are acute neuroinflammatory disorders like Guillain-Barré, encephalitis, myelitis, but it's also an observatory that allows us the discovery of emergent viruses, and particularly the investigation of the association of viral disorders with acute neuroinflammatory illness. So we have established protocols. And this is important because Zika plan actually allow us to interact with many researchers around the world. And many of you in Europe, and many of you in Latin America, Brazil, have been very supportive of our efforts. In the case of Guillain-Barré, the support of IGOS and the effort that has been invested in characterizing Guillain-Barré cases around the world actually serve very well in the purpose of the NEAS network. So up to date, we have been able to establish an observational study since 2016 that have accumulated more than 625 patients in a different spectrum of neuroinflammatory disorders, from Guillain-Barré to encephalitis and myelitis and other cases of neuroinflammatory disorders. But as you can see in this graphic that is derived from more than 620 patients recruited up to January of 2021, we have seen a majority of cases with Guillain-Barré, but also seen other patients with encephalitis and other disorders. And this observatory actually allow us to be ready to the COVID-19 challenge, and actually the laboratory resources that were established at the University of Valle and VREM with Dr. Parra and Lida Osorio actually allow many healthcare resources to be used for research and diagnosis of COVID-19 problems. So this is basically one of the bases of the network, is to be ready for rapidly response to emergent situations, including infections and viral disorders. One of the important aspects that are left from our experience with the Zika plan is that there has been a quite tremendous amount of investment in diagnostic resources and capacity. I mean, in the laboratory, not only the implementation of the classical techniques for virology and immunology diagnosis has been implemented, but also the introduction of new technologies like next generation sequencing, and actually the novel studies with the virus scan and toxome scan have allowed us actually to establish better links in terms of molecular biology, the immunology of the infection background of the patients, and have allowed us to identify even the links between previous infections like dengue with cases of Guillain-Barré in the context of Zika. Sonia mentioned the case of Peru. The network of NEAS actually facilitate the good interaction with our colleagues in Peru that were dealing with problems with Guillain-Barré. And actually, this was a very good example of transferring all the experience from a country that is similar to us, Peru, in which very rapidly we were able to respond to the challenge of an outbreak of Guillain-Barré, and went very quickly to help our colleagues in Peru from diagnosis, immunology to even phylogenetics, and we were able to establish the characteristics of the Campylobacter jejuni, and even to determine by molecular approaches if this was a new strain that was emerging in Peru, or this was just the circulating strain that was already in the world. And the conclusion was this was already a strain that had been observed in China, Africa, and Europe. And this is just a reemergence of a pathogen in a country like Peru. But one thing that probably is important to outline is what is the legacy of our projects supported by Zika plan. One of the efforts has been characterize the patient population that was affected in 2016, 2017, and after by different immunological disorders, including Guillain-Barré. And we have paid a lot of attention to characterize the functional outcomes of those patients to determine not only the neurological outcomes, but also to determine the characteristic of social situation and access to healthcare. And that led to some of our young doctors and young physiotherapists and young healthcare providers actually to create resources that are going to be very helpful in our countries where there are limited access to physical therapy or rehabilitation. This is an example of one of the important projects that has been developed by some of our young rehabilitation doctors and healthcare providers that designed this app that is an app that can be used in Macs or any other platforms like iPhones and tablets that basically facilitate the process of rehabilitation when there is no physical therapist or occupational therapist next to the patient. And actually, this app is going to be implemented in Spanish and English and hopefully in Portuguese, and it's going to be a very good tool for patients for rehabilitation and recovery. So this is actually providing patients with better support. And I like to finish with the legacy of Zika plan in Colombia and for NEAS. And it has been a very fantastic support because this allows us actually to implement a plan for 4 years to make sure that the NEAS continue to be an observatory for inflammatory and emergent viruses. And in that way, we are building capacity for laboratory research. We are bringing new technology like next generation sequencing and a phage-based technology for immunological diagnosis. But most importantly, we are investing in education and building human capacity to make sure that the new generation of healthcare providers, scientists, and physicians actually have the capability to use the molecular diagnostic tools, the computational biology tools, and all the new techniques that are going to provide better diagnosis from virology, immunology, and clinical point of view. And I'd like to finish just acknowledging all the players and particularly our collaborators in Europe to Bart, Sonia, Hugh, Tom, Susie, and all of the people in UMEA because it has been a great lesson for us and a very good resource for improvement of diagnosis and healthcare in patients with neurological disorders in Colombia. Thank you so much.
Thank you, Carlos, for such a wonderful presentation. And so please ask your questions by chat or unmuting yourself. And while people, they are thinking about their questions, Carlos, I can start the discussion. So what are from the Zika plan legacy, as you talked about, and the sustainability? What are your lessons learned and key messages for people who are now establishing neuro-COVID cohorts or any such longitudinal research studies? So what would you advise to do them much better, that there is more sustainability and scalability?
So one key element is the element of coordination of effort from epidemiology, laboratory research, and clinicians. One thing that we learned very well during the Zika outbreak was the language of communication. So I think that I need to acknowledge that traditionally in Latin America, the language of scientific communication is a barrier for development. And I think that in Colombia particularly, the ability that we have to establish a very good rapid communication between epidemiologists, public health provider, virology, and clinicians, researchers actually was one of the key elements for the success of this effort. So I think the message for the future, and we are learning this during COVID-19 as well around the world, is communication and collaboration should be the the major support for what we are doing in clinical research during outbreaks.
Thank you, Carlos. Just seeing if there are any other question for Carlos. Lida,
yes, maybe
yourself.
In the meantime, while you look for another one. I think one key is actually to build capacity, to help each member of the cohort to improve their capacity to do research. Every member of the group, of the network, had to be better after being a member of the cohort. I think that in mind, it's very important. The strong members make a strong network. Yeah.
Thank you, Lida. Hugh, yes, you're
here, Taryn. Carlos, just in general terms, I mean, what you've presented is, of course, fantastic in an aspirational sense, and hopefully will become fully practical as well. But these are incredibly expensive networks to run, as people like Tom and Taryn and yourself know. So in terms of an overall sort of strategy for funding these kinds of enterprises, do you think we should be aiming for big things like Zika plan, or for lots of little things, or going to, you know, some of the bigger philanthropic charities than we have done historically?
Hugh, that is a very good question. We may need to reach to these large networks, and I think that this is the only way to go. In many ways, we have been successful because we had Zika plan, and we have been successful to submit applications to the National Institute of Health in the United States because we had that data that Zika plan allow us to produce. So I think that we were able to initiate our NEAS network in Colombia using philanthropic support. One family of one of our patients supported our efforts. But that actually allowed to invest more and more in the interaction that we had with you, and also the interaction that we developed with other researchers around the world for implementing things that were basically scarce or were not available in Colombia. So one of the philosophy of this network is building capacity for laboratory research, for diagnosis, and this is critical. And the only way to go with that is with the support of large entities like a Zika plan. I think that government agencies that support research should invest more on these networks, and the lessons from COVID-19 is critical. It's the only way to go.
Thank you, Carlos. Tom, just wondering how much time do we have, or should we hand it back to you for wrapping up?
I think that's a perfect time to hand back, and especially that final question and comment from Carlos. I think Annalise is going to join me, but Carlos, thanks very much to you and to everyone in that last session for those thoughts and comments. I mean, I think the question about funding is a really important one. We have been funded because of the Zika emergency. Many of us have then built additional funding on the back of that. And now with the COVID emergency, you know, we've been able to capitalize on that. But I think in some respects, one wants to retain the broader underlying networks. One doesn't want to keep reinventing networks and reinventing, you know, the wheel, as it were. And so, you know, one part of the legacy, I guess, is even if Zika plan has formally finished, we have whole groups of collaborators now who work together and working together on things like COVID-19, and will continue to do so. And it's important for all of us to, in our funding applications, just to make sure we allow a little bit for the kind of networking opportunities, the broader meetings, etc., that bring people together. Let me pause there for breath and to see if anyone else has any comments on that. I have a few final closing comments, and then Annalise does, but did anyone want to comment on that sort of funding aspect and future perspectives aspect?
I mean, just Tom, just to add that I echo what you are saying. I think Zika plan and other cohorts or consortia that have been established, I think we need to have better and further mechanisms of collaboration and coordination and harmonization of the efforts that are, across the different continents. So, so bringing in the experiences from Latin America, Asia, Africa, Europe together. I think and there should be like funding for some, I would say, like a consortium of consortium, in a sense that we are able to learn from all these different experiences. And I think this could be an important message from Zika Plan to different research and policymakers.
Yeah, I mean, I'm sure Annelies will have a comment on that. But, one of the challenges is that people like to fund research. They don't like to fund networks as such, that aren't actually actively doing research. So, as long as there are emerging neurological problems, then presumably we will continue to get research funded. But it's more in peacetime. How does one keep people connected in peacetime? And Annelies, do you have comments on that before we do our final wrap up?
No, thank you for your comments on the legacy and how we've had many spin-off funding as well as spin-off research, and we have enlarged as a network of networks, and that is because Zika plans set the seed. Indeed, you correctly pointed out that the European Commission does not fund networks for the network's sake. So you have to have an original research question, hypothesis, and then work on it. But I think as a Zika plan, we have shown extraordinary spin-offs and additional funding, I think more than many other consortia before, and I think that's our legacy, and we need to communicate that back to the European Commission.
Thank you. Thanks, Annelies. Let me just say a few final words, particularly in respect to the seminar we've had this afternoon. I mean, I think it's been brilliant for us to get people together, even virtually, if we couldn't do it in person, and hopefully we've displayed the range of approaches to tackling both peripheral nervous system disease and central nervous system disease, and to look at it both all the way from the epidemiological through to clinical and diagnostics down to disease mechanisms and basic biology. And we've had some beautiful of that this afternoon, and I think anyone who is watching and is new to the consortium will see how much interaction there's been, how much there's overlap. There are no silos within this Zika Plan consortium. There's very much, it's all about integration and interaction. We've seen some really good impacts, both in terms of studying and impacting on Zika itself, and then also some of the slightly more remote impacts in terms of things like the fantastic Guillain-Barré syndrome clinical approach that's been published and that's available as a web tool that applies to all aspects of Guillain-Barré syndrome. I want to thank all the people involved, not just those presenters today, many other scientists involved who've not presented today, but who've made enormous contributions. We want to thank the funder, I'm sure, and also our team in UMEA who've given tremendous support throughout this whole program. And working with EU funding is not the most straightforward thing, but the team at UMEA, particularly Raman, have kept everything on course beautifully and brilliantly. I'll just, before I hand over to Annelies, I will say I would like everyone who can to turn their cameras on at the end for our final goodbye. So if all the panelists will turn their cameras on, and we will all say a bit at the end. But Annelies, let me hand over to you at this point.
Well, thank you, Tom, and thank you to all the chairs and the excellent speakers. I really enjoyed today's webinar. So 1,000 thanks to the entire Zika Plan Neuro Zika. So as Zika Plan overall scientific coordinator, it really has been a pleasure to working with all of you over the past almost 5 years, and new friendships have been built and new networks indeed have been established. If you are not part of Zika Plan and you are part of the audience and you would like to learn more about Zika Plan and our achievements, please do go and look up our website. Just Google Zika Plan and you'll get into it. You will find a detailed description of our projects, of our experts, but also our publications. There is also training material available, and so do have a look. I also want to add to Tom, again, words of acknowledgements and thanks. And central to Zika Plan is always our Zika Plan Executive Director, Dr. Raman Preet, with the hosting institution Umeå University in Sweden. Also heartfelt thanks, of course, now to the Global Health Network. Yes. Yes, those good old times where we had all these audiences. And then special thanks also to the Global Health Network, who gave us the platform for these webinars and really pulled this together very professionally. Many thanks to Bonnie Baker. Also, many thanks to the entire communication team at the Fondation Mérieux. So a lot of thanks to all of us. So the last words is about the next webinar. And that's our final webinar. So for our final, for our dissemination, we had planned a face-to-face meeting in Brazil, which is now not possible. And so we have 3 events in total. Today was the second, and our final one is on the 24th of March. And this really will focus on the legacy of Zika Plan. We will have panel discussions with the European Commission, with Globit R, with other funders, Fiocruz within, and with the other Zika EU-funded Zika consortia. We will talk about the training networks, the capacity building, the laboratory networks, the clinical cohorts, and the clinical networks also related to neurology, as heard today. I think Lida Osorio's words we should end with those. Strong members make a strong consortium. So thank you for being strong members over the past 5 years, and let's see each other again on the 24th of March for the final legacy discussions. Thank you so much to everyone.
Thank you, Annelies. And of course, the one person we must thank, as well as Raman, of course, is you for your wonderful leadership of the whole consortium. So I've asked everyone to unclick their microphones, and we'll give a big to Annelies and all the whole team. And then, so if everyone could unmute your microphones, and then after 3, as is traditional for any meeting I host. So after 3, 1, 2, 3, goodbye.
Bye.
Bye.
Adios.
Bye. Thank you.
Thank you.